This video will describe the records needed for a double arch dentate chrome case. All of our records are available on our website. Just visit Chrome GS on our website and then patient records. And on that page, you'll see a grid for the different types of patients that present. And then if you scroll down, all of our checklists are here. And then below, examples of records. With a double dentate case, the records are very similar to a single, just a little variation. But as with all of our dentate cases, any edentulous, we want specific photographs, we want master cast or scans, if you have digital impressions, and of course a bite registration, and a CBCT scan. In this case, there will be 2 scans, unless you have a large field of view. So photos, casts, and CT scans. Let's go through the photos real quick. We always require photographs in occlusion, retracted, center, left, and right. And it's important to have the patient in their normal bite so that we can make sure the case is articulated correctly. We want a regular smile. We want an exaggerated smile, and then profile pictures. Generally, if we're dealing with a class 2 or class 3 situation, we want a profile, but you can always send a profile. And then we do not need any photos of occlusion. We do not need any ortho photos, just the photos on the left. And then just try to have the patient looking directly at the camera and a more exaggerated smile and centered. The master casts are crucial to making the chrome properly, especially with the fit of the initial pin guide. So we want very accurate master casts. We want full models, not partial models, and then of course, very high quality. With double dentate, of course, we need both arches, and they can be digital or they can be analog, whichever you prefer. It can be an alginate poured up in stone. Either variation, the whole spectrum is fine. And with the maxillary cast, we always want a full palate all the way back to the vibrating line. You want to capture the full vestibules. This is very important for how the initial pin guide fits in, especially the vestibules. And if you want a backup denture, we need the full palate. And then same with the opposing, all the land areas. And then, of course, in occlusion. If the patient has a partial denture, then you'll capture 2 impressions. One as a study with the partial seated, and then one without, especially if the partial is helping with occlusion, with the bite. If it's not, then it's okay. You can just take impressions without the partials. But if it'll help us articulate the case, then send us both, one with, one without. And when you take the CT scan, you'll take the scan without the partials in the mouth. If they're just acrylic flippers, not that important, doesn't matter, but best policy is just not have any partials in the mouth during the CT. With the CT scan, if you have a large enough field of view, in other words, if you go from the chin all the way up to the eye orbits or the full skull, then you can just send that scan in. If you have a smaller field of view, then the chin up to the opposing teeth, and then from the orbits or the bottom of the nasal floor down to the opposing teeth, those are the 2 ranges. And always, always, always have the patient open, out of occlusion. So you can have a bite fork from the scanner. You can have cotton rolls with the patient's chin on the chin rest. Different ways of doing it, but never ever teeth together. We will make a phone call on this and have a new CT scan. And then when the CT is finished, you'll just simply export the set of single file DICOMs, and you'll create a zipped folder and you'll upload them to the website. In this case, I'm just showing an example of exporting the DICOM. So this patient is patient Cook, exported it to a particular drive on the system. A lot of offices will just export to the desktop and keep a master folder. But inside that folder, there'll be a set of single files. These are DCM files. In this case, there's 511. So this is a set of single file exports, as opposed to just one file. You'll want multiple files. They're the slices of the scan. So once you've exported this, you'll go back to, we were just looking in the folder here, but go back to the master folder, and then you will right-click on the folder because we need to zip it. So right-click, go down to Send to Compressed Zipped Folder. All systems will have something very similar to that logic. So send to compressed zip folder. And what the computer will do is it will compress the files into one folder, and you'll see right here that it's going through all the DCM files and compressing. And then what will happen is you'll have another folder right next to this original folder, and it'll have a little zipper on it. And that's the folder that you will drag and drop into our portal or browse for in our portal. And you'll upload that along with the photographs and the digital impression STL files. If you've made STL files, you'll upload all three of those into our portal, and that's how you'll submit the case.